walking. All right. Thanks a lot, JC. I'm out here in the newsroom with Dr. Gervasio Lamas from Mount Sinai, and we're talking about cardio, health and heart health and prevention too of some really dangerous things. So tell us a little bit about what we really need to do right now to keep our hearts healthy.
Well, health of the heart is really key, and in order to do that, the common diseases are the ones that need to be focused on, and that's hypertension, high cholesterol, obesity. All of these are going to ultimately plug up the coronary arteries, and so a strong preventive program is a sane diet, exercise with an emphasis on aerobic fitness, flexibility, and some strength training, and see your doctor and make sure that your cholesterol is within appropriate range and that your blood pressure is well managed.
We always talk about exercise being so very important. What is the rule of thumb, though, when it comes to exercise? Do we need to be doing something every day? Does it need to be hours every single day, or is 30 minutes enough?
You know, in our society where exercise, all of us have desk jobs ultimately. Mm-hmm. I mean, I walk around in the hall maybe. Mm-hmm. So 20, 30 minutes, about 3 to 5 days a week is going to get you the bulk of the kind of fitness that you need. On the other hand, if you can do more, if you can spend more time exercising on a weekend, and above all, keep a sane diet, because you can always beat any amount of exercise with your mouth. Okay?
All right, what's a sane diet, though? I mean, is it no sweets, no carbs? What's sane?
A sane diet is a diet in which you are moving away from a lot of animal fats. The carbohydrates are more complex. So among Latins, one should try to avoid the white breads, the Cuban bread, the rice, less of that, and smaller portions. If you can serve your food in smaller plates, you'll find that you end up eating less.
Aha. And you talked a little bit, we were talking about rhythm issues, heart rhythm issues. There are more treatments now for that, but what should people be looking out for to know that they may have a problem, to spot a problem that's just beginning? You
know, heart rhythm disturbances can be all the way from sudden death, where the heart essentially stops and the lights go out, to severe palpitations. And in all of those, there are new ways that these rhythms can be treated with using catheter-based technologies. The area that's causing the heart rhythm disturbance can be located and then actually burned so that the rhythm disturbance stops. And these are tremendous advances. The alternative in many cases is to take complex medical regimens for a long time that have a lot of side effects. And so it's very helpful to make sure that if you are having a heart rhythm disturbance that is troublesome to you, that you end up seeking a second opinion if you're not getting what you need.
And has much changed in the way of women in heart disease in terms of, I know we've done many studies about women going to the emergency room and being told, well, it's probably stress related, you're doing too much at home, and not really getting the heart health that they really need.
Well, there are many aspects of women that are really quite different. The first thing is that the woman's role in the house as a caretaker in many households essentially moves her away from seeking help for herself. And in fact, I have many patients men patients who are alive because of their wife. I look at the wife and she is overweight, out of shape, and she doesn't want to see me because she's the caretaker and doesn't want the trouble. So that's one important aspect. Another very important aspect is that heart disease really does present somewhat differently in women. Mm-hmm. Heart attacks, chest pains that are due to coronary disease don't really occur as often and as typically in women. This sort of crushing Hollywood heart attack, women don't get this. Mm-hmm. They may have nausea, sweating, some back pain, belly pains, and even as a suspicious physician, you end up getting fooled.
Mm-hmm. So think it's something else.
You think it's something else. I mean, you have no idea how many times I've said to myself, this is going to be a gallbladder attack. And you know what? It's not a gallbladder attack. It was the heart. Uh-huh. So you just have to be very suspicious when you have a chest-related symptom in a woman. What is this? Could it be the heart?
Okay, well, very good. I'm going to let you get back to the web chat and let your fingers do all the answering of these questions. And if you have any questions for Dr. Lamas, go ahead and join us at justnews.com. He will be here till 10 o'clock today. Nice to have you with us. And I know that you'll get all those heart-healthy questions answered. JC?
Okay, sounds good. Thank you, Kristi.